Good morning, and I'd like to welcome everyone to this webinar on the topic Breastfeeding Protection in Latin America and the Caribbean, jointly organized by UNICEF and PAHO. Welcome, everyone. This webinar will be held in English and Spanish, and there is simultaneous translation in English, Spanish, and Portuguese available. For that, please click on the globe at the bottom of your screen for the translation or the interpretation. I'm also going to ask you or let you know that the Q&A will be activated so you can place your questions for the speakers in the Q&A box as we go along. And finally, I'd want you to know that this webinar is also being streamed on PAHO's YouTube channel. Now I'm going to hand over to Eduardo Celades, the Survive and Thrive Regional Advisor for UNICEF in the Lacro office, and he will give his opening remarks.
Gracias, Audrey, and buenos días, colegas.
Thank you, Audrey, and good morning, colleagues. Good morning, everyone. I will speak in Spanish. Please join the interpretation channel. I would like to welcome everyone. Thank you very much for joining us to commemorate the Regional Day on World Breastfeeding Protection Day. And I really like the fact that it reads protection, since we definitely need to protect breastfeeding, maternal breastfeeding. In the latest years, we've seen diverse interventions through evidence, and they're all very important, such as maternal breastfeeding, healthy nutrition. They're all questioned, and for this reason, we need to coordinate and jointly commit and respond to such attacks in one way or another in order for us to protect maternal breastfeeding. 54% of infants receive exclusive breastfeed. They're exclusively breastfed within the first hour, and 43% up to 6 months of age. However, there's an extensive trajectory to cover. There's many things to do and several common efforts to develop. Throughout the day, we'll listen to our diverse panel speakers, and they will share different proposals and their analysis on the situation. We do believe there are four fundamental factors interrupting progress and still creating a certain environment we still need to work on. And one of them is precisely the aggressive industry practices. The second factor is precisely the misinformation through social media on a daily basis. At the same time, there's a lack of support from health systems. And finally, a weak implementation of public policies. And in order for us to respond to such challenges, the only thing we can do is work jointly. UNICEF, PAHO, the governments, the civil societies, the mothers, caregivers, they should all work jointly to respond to diverse challenges and succeed in set responses. From UNICEF, once again, we confirm our commitment for us to work jointly, and in this way, develop environments that truly protect, promote, and support maternal breastfeeding in our region. Thank you very much once again for joining. We believe that the knowledge shared, the experiences shared today amongst our colleagues will definitely serve as an inspiration to everyone and strengthens your efforts at a country level. Thank you very much for joining in.
Thank you very much for those opening remarks from UNICEF. As I mentioned, this webinar is being hosted jointly by PAHO and UNICEF. I am Audrey Morris, PAHO Regional Advisor on Food and Nutrition, and I'm now going to welcome Vanessa Garcia Larson, and she is the Chief of the Risk Factors and Nutrition Unit in PAHO in the Department of Non-Communicable Diseases and Mental Health. Welcome, and go ahead, please, Vanessa.
Thank you, Audrey, and thank you everyone for joining us today. Welcome everyone to this webinar on breastfeeding protection in Latin America and the Caribbean. This activity is jointly hosted by the Pan American Health Organization, PAHO, and UNICEF. This collaboration is key because PAHO acts as the regional office of the Americas for the World Health Organization, which with UNICEF facilitated the development of the International Code of Marketing of Breast Milk Substitutes, and now together advocate and support countries in its implementation and monitoring. The International Code of Marketing of Breast Milk Substitutes was adopted by the World Health Assembly on the 21st of May in 1981. This meant that families would be protected from the infant formula industry and their aggressive marketing tactics aimed at promoting breast milk substitutes. From time to time, we know that these tactics have contributed to declining breastfeeding practice and increasing child morbidity and mortality. We know that under conditions of poor sanitation and illiteracy, the use of infant formula contributes to deaths of babies from malnutrition, diarrhea, and pneumonia. By the 1970s and 80s, there had been an increased incidence of necrotizing enterocolitis, affecting up to 7% of all preterm infants who were not being breastfed with human milk. There is, of course, a wealth of scientific evidence demonstrating that breastfeeding is the best option to feed babies. Based on this evidence, PAHO, WHO, and UNICEF recommend the practice of exclusive breastfeeding for the first 6 months of life, followed by the introduction of nutritionally adequate and safe complementary foods, and continued breastfeeding up to 2 years of age. Despite these recommendations, global sales of formula were projected to increase from $44 billion in 2014 to over $70 billion over the next 5-year period ending in 2019. On the other hand, the lack of breastfeeding is also associated with economic losses of about $300 billion annually, and this is largely due to low cognition. And in addition, there has been economic losses that are attributed to disease, premature mortality, and healthcare. Importantly, scaling up breastfeeding could prevent over 820,000 deaths in childhood every year. For the code to have the maximal effect in the regulation of the marketing of breast milk substitutes, such as infant formula, in keeping with the resolution, all member states should give full and unanimous support to the implementation of the recommendations made by the joint WHO-UNICEF meeting on infant and young child feeding, which was held in 1979, and translate the international code into necessary national legislation, regulations, of other suitable measures. This hasn't happened at the pace that we had hoped for. Progress in this area has been lagging in the countries in the region, and we will hear today from the upcoming presentations about the trends that have been observed in this matter. For too many countries, far too many countries have failed to put in place the legislation and monitoring of the code, and applicable sanctions to the infractions, and others have not realized that the legislation has not been kept with the pace that has been required over time. The end result of this lack of action is that breast milk substitutes are still being successfully marketed and widely used. While there has been inaction from many countries, marketing of breast milk substitute has become even more pervasive and aggressive. When the code was adopted in 1981, many of the strategies that are now being employed by marketing companies such as digital marketing didn't exist. However, there are regular WHA resolutions to update the code and to fill in the gaps. The code remains as relevant today as it was in 1981. So in today's webinar, which is being held on the 44th anniversary of the adoption of the code, we hope to provide information on what is currently happening with the implementation of the code in the region of the Americas, and also hear how member states can take the necessary steps for the protection of breastfeeding so that more babies can be optimally fed. On behalf of the organizers of this webinar, I welcome you all today, and we look forward to your full engagement and participation so that we can pledge and continue the support that PAHO, UNICEF and the WHO are providing to countries in our joint effort to protect children's rights to health and to good nutrition. Thank you.
Thank you so very much for your opening remarks and for helping us set the stage for what we're going to present to you today to our audience, or our participants online. We have so far more than 500 participants online. I'll let you know that when the room reaches capacity, for those who cannot join, we are also streaming live on YouTube, on PAHO's YouTube channel. I'll also remind you that there is interpretation available, and for that, please click on the globe at the bottom of your screen. And finally, as some of you have already been doing, please continue to place in the chat who you are and where you're joining us from. All right, so at this time, we're going to get into the thick of things, and I'm going to introduce Michelle Alvarez. She's a UNICEF Food Systems Specialist, and she's going to take us through an activity, and then she will make a presentation giving us a regional overview of child nutrition, breastfeeding, and code status. So over to you, Michelle.
Thank you, Audrey. Muchas gracias, Audrey. Muy buenos días y buenas tardes a todos. Me
Thank you
sumo
very much, Audrey. Good morning and good afternoon. I would like to first off thank you everyone for joining today's event to commemorate the World Breastfeeding Protection Day. As stated before, my name is Michelle Alvarez. I am the food system specialist within UNICEF Lagro office, as stated by Vanessa and Eduardo. Breastfeeding is a fundamental pillar for survival and children's adequate development. However, our region still presents several challenges, but at the same time, grand opportunities. Before we get into details, we would like to hear from you and reflect and think about why we are here today. Why is the code's implementation fundamental for Latin America and the Caribbean? For this, we would like to invite everyone to please join the Mentimeter, either by scanning the QR code on screen or by joining the link I just shared in the chat box. We would like to hear your opinions, your thoughts, and remarks on the matter in order for us to start with today's presentations. I will leave the QR code on screen a few seconds and eventually share a few responses.
Voy a compartir algunas de sus respuestas y también en el
I
chat.
will share a few responses, and in the chat you should find the link to the Mentimeter in case you would like to add more comments.
¿Pueden ver mi pantalla? ¿Pueden confirmarme que ven mi pantalla?
Yeah, sí, ahora
I
sí.
hope you can see my screen. When we ask why implementing the code is important for children in Latin America and the Caribbean, to promote maternal breastfeeding or breastfeeding, to promote and to regulate lascivious marketing, to defend the rights for nutrition. It's a fundamental framework since it establishes a legal framework to protect, guarantee, and promote children's rights, protect and sustain the health and well-being of our children, ensure healthy growth, to resist marketing, to protect and promote breastfeeding, for children's rights, to guarantee children's rights, because it's fundamental to promote children's rights, to regulate the industry. Perfect. Great. Thank you very much for your remarks. Thank you for participating on the Mentimeter as well. And it will serve as a starting point for today's event. Allow me a moment to share my screen. Could you please confirm if my screen is visible or not? Yes. I hope it's on full screen. I hope you can hear me. Yes, we can hear you, and it's visible. Perfect. Thank you very much. Throughout today's session, we will most likely answer the questions, and maybe a few more questions will come up. Feel free to share your questions, responses, remarks in the chat box, and throughout the session, we will answer them and dedicate some time at the end to answer a few live. First, I would like to share the nutritional status of children under 5 years of age in Latin America and the Caribbean. As you can see on the map, our region is affected by nutrition's double burden, characterized by child obesity above the overall prevalence from 5.6 to 8.6. You can see there are countries with prevalence above the regional prevalence, as a matter of fact. At the same time, the region is affected by chronic malnutrition. Even though it's below the global prevalence, our prevalence is still above 10% in most of the countries and around 20% in a few countries, such as Ecuador, Haiti, or even 40% in countries such as Guatemala. On the next slide, you can see how chronic malnutrition has reduced in the last 2 decades. However, the reduction has stopped. It still affects millions of children in our region. On the other side, child obesity and child overweight continues increasing exponentially and continues affecting children from a very early age. We know exclusive breastfeeding from the first hour of life from the first hour of life and continue up to 2 years is fundamental for all children independently of their context, and it's the best way to prevent all forms of malnutrition. UNICEF and WHO recommends the early start of exclusive breastfeeding from the first hour of life, and in this way guarantee children's survival, adequate development, and at the same time contributes to the development and promotion of maternal breastfeeding. However, we have seen how only 1 out of 2 children receive are breastfed within the first hour of life. When we disaggregate the information by country, it's still more concerning. We can see that most of the countries' prevalence show about 50%, but about 3 countries present prevalence below 40%. However, we can see that in some countries in our region, we just don't have sufficient data in order for us to monitor the different indicators and decide accordingly. Exclusive maternal breastfeeding up to 5 months of age is indispensable to ensure adequate nutrition. However, we've seen in our region that less than half of children are exclusively breastfed up to 6 months of age. As a matter of fact, it's quite below the global prevalence. When you disaggregate this information by country, it's still more concerning. You can see that most of the countries' prevalence is around 30 and 50, 30, 40, 50%, and some countries even show prevalence below 30%. And we know that the prevalence basically reflects how committed health is and how committed children's health, nutrition, and development is overall. There's a few countries with prevalence above 70%. And once again, you can see that there's a lack of data for some countries, and we just cannot monitor the indicators or contribute to the decision-making process. And this is the case for about 8 countries in the region. On the other side, continuous maternal or continuous breastfeeding still offers fundamental nutrients for children's development. However, in Latin America and in the Caribbean, we see that 1 out of 2 children receive continuous are continuously breastfed, and this is still below the global prevalence, which is around 61%. Now, which are the main factors or challenges to breastfeeding in our region? There are several factors, but just as Vanessa and Eduardo mentioned at the beginning, aggressive and deceiving promotions and advertising of formula and maternal of formula, of course, affects their decision. These aggressive campaigns, of course, may generate doubts on their capacity to offer an adequate nutrition to their children. At the same time, there's an absence of regulatory frameworks that protect mothers, fathers, and caregivers from this aggressive and deceiving advertising. They all place this practice at risk. At the same time, there are diverse stakeholders that may influence, such as the lack of support from health establishments or even direct support to mothers. The early separation between mothers and babies at the moment of birth, lack of support to families to assist them in continuing breastfeeding their children once they return to their working places.
Creo que hubo un problema técnico.
I believe there was a technical issue. Thank you.
Además de la ausencia de políticas amigables de las familias, algunas normas sociales
Aside from the absence of friendly policies and the contribution from social cultural factors, there are several factors that may affect breastfeeding in diverse contexts. Breastfeeding is also affected by the weakened capacities of health staff and at the same time not knowing how to adequately support mothers and promote breastfeeding. It's fundamental for us to understand the challenges and in this way provide adequate solutions to promote breastfeeding. As we strengthen regulatory frameworks and policies aligned to the International Code of Marketing of Breast Milk Substitutes, it's all fundamental to contribute in ensuring adequate nutrition for all children. In the upcoming presentations, we will see more details related to the code, but in general terms, the code establishes a series of dispositions and its objective is to stop the aggressive and inappropriate trading and advertisement of breast milk substitutes. The subsequent resolutions from WHOs have kept the code updated since it was created back in 1981. This is a fundamental component in order for us to generate public policies and guaranteeing that mothers, fathers, and caregivers are protected from inadequate and deceivious information affecting breastfeeding and at the same time endangering children's life and adequate development. Every year, UNICEF, WHO, and INFAM publish the report on the code's implementation at a global level. Last year, the report analyzed the different frameworks at a country level, analyzing how aligned are they with the code. On this slide, 30 out of 35 countries, only 19 countries have adopted legal measures to consider dispositions from the code. At the same time, you can see that only 2 countries, Panama and Brazil, have measures substantially aligned to the code. Our region has 16 countries with no legal measures and 8 with legal dispositions. In comparison to other regions, one can see how Latin America and the Caribbean is actually the second region with the least countries aligned with the code, and at the same time, we're the region with more countries that do not have legal measures at all. Now, considering the previous report, this is a summary on a few legal dispositions from the code and how they have been incorporated into countries' legal frameworks. We can see that only two countries have taken actions to include all breast milk substitutes up to 6 months, 36 months of age. Two countries have established prohibitions that promote breast milk substitutes educational material or advertisement. At the same time, we can see that there's a lack of regulations on meetings or scientific sponsorships such as travels, research events. There's no regulation for these activities. UNICEF conducted an analysis based on the report's analysis, and this information was presented back in 2024
Los actores
and
clave en esta agenda, así como
analyzing all national regulatory frameworks related to the agenda and assessing challenges and opportunities as well. As you may notice, we still have great challenges regarding gaps, limitations within existing legal frameworks. At the same time, we have noticed there's a lack of resources to constantly monitor the code, as well as an absence related to legal mechanisms for surveillance and compliance, and at the same time, all related to the code. On the other side, we can see how the industry intervenes in the development of advocacy efforts, policies, and actions for the protection of breastfeeding is still an important challenge in order for the code's adoption. And lastly, but not least important, we have noticed that in Latin American and Caribbean countries, there's a limited institutional capacity related to understanding the code, understanding how to strengthen regulatory frameworks and how to establish monitoring, effective implementation, and surveillance and monitoring efforts related to the code, including subsequent resolutions related to WHO. Even though there are grand challenges, our region has grand opportunities as well. Currently, there's a few countries with ongoing legislative processes to update their legal frameworks. At the same time, there's an ongoing governmental interest to strengthen their laws, and at the same time to improve their mechanisms at a global level and at a regional level. We do have several resources for monitoring the code, and we will share a few in a moment. At a regional level, we're currently developing a law that will serve as guidance for governments to strengthen their regulatory frameworks, and it should be adopted by Latin American as well as by Caribbean countries, which is from the Caribbean. We have diverse resources at a global level, at a regional level, and at the same time, the intention is to strengthen skills for both governments as well as key stakeholders. We do have successful experiences, and from those I can mention the one from Panama and Brazil. And lastly, our region is characterized by a close collaboration between the academia, United Nations organizations, the civil society, and all to promote policies that promote nutrition for children and adolescents, all aligned with the code, of course. At a regional level, we promote nutrition, Alsana. There's a QR code on screen if you would like to be part of Alsana, which is a partnership for healthy nutrition for children and adolescents. The intention is to create healthy environments for children and adolescents. This is a coordination platform and support platform between key civil society stakeholders, the academia, and United Nations to support governments as well. And lastly, throughout today's presentations, we will listen to a few recommendations. It's very important for us to create, review, and or update regulatory frameworks aligned with the code. The report from 2024 is essential to identify gaps in the existing legal frameworks. At the same time, the mapping process from UNICEF, it's a very useful tool and we're open to sharing it with you as well. On the other side, it's important to support governments and recognize their obligation to guarantee rights for children and adolescents, guarantee adequate nutrition, health, survival, and to grow and develop in healthy and safe environments. At the same time, it's very important for us to continue new ways of advertisement or marketing. And lastly, guarantee adequate nutrition rights. It's an effort we need to jointly take action in order for us to strengthen our efforts and strengthen advocacy amongst different partnerships, the civil society, the academia, and the government to ensure the code's implementation. From UNICEF and from UNICEF and PAHO, we're open to supporting the agenda from the different stands. Thank you very much for your attention. Audrey, over to you.
And thank you so very much, Michelle, for your presentation, which really was very enlightening, reminding us of the status of breastfeeding in the region and really going into some of the reasons on, why this code is so important. I will remind participants that there is interpretation available by clicking the globe at the bottom of your screen. For those persons who are unable, well, they're not hearing me, but there is a tendency sometimes to mute ourselves. So just check that you are not muting the original audio, so that is the reason why some people are saying that they cannot hear. But I'll just ask the technical team to make some checks that there's no interference from our side. All right, so I'll ask you again to hold your questions for Michelle. Just place them in the chat as we go along. We're going to move to our next presentation, and that is from Carmen Casanovas. And Carmen is a PAHO consultant on breastfeeding and the baby-friendly hospital initiative. And she's going to, in this presentation, review some of the telling evidence for why the code is so necessary, and she'll go into the results of a multi-centric study with concerning findings. But over to you, Carmen.
Thanks, Audrey. I'm going to share my presentation. Can you see it?
Yes.
Okay. Well, this presentation is entitled, Why is the Code Essential? And I'm going to be presenting very briefly the recommended practices and the benefits of breastfeeding. Then I'm going to be talking about the interventions that increase breastfeeding that have a scientific basis. As Dr. Morris was saying, I'm going to be presenting some results of the multi-country evaluation, key findings of this evaluation. And finally, I'm going to talk about the importance of the regulation and monitoring of the marketing of breast milk substitutes. The recommended practices, as we have been listening from different speakers, we have 3 recommended practices that are the early initiation, start breastfeeding within the first hour of birth, then exclusive and responsive breastfeeding, that covers the period of 0 to 5 months, and continued breastfeeding to maintain breastfeeding up to 2 years of age or beyond. Here I'm going to be presenting very briefly only the benefits for infants and mothers, but we know that the benefits include families, include the society. We do have more benefits at various levels. But in terms of infants, we have short-term benefits and long-term benefits. In short-term benefits, we have the reduction in the risk of mortality and morbidity.
And very important because we do have to protect also newborns that are small. Necrotizing enterocolitis is less frequent in the children that are breastfed. It's almost gone in many countries, in many places, and also less risk of sudden death. In the long-term benefits, we have the one that has been talked about very largely, that is the increase in IQ. We have the decrease in overweight, obesity, decrease in diabetes type 2, less leukemia. For the mother, we have less bleeding, less ovarian cancer, less risk of diabetes type 2, less overweight, obesity. So we do have a lot of benefits for both members of the diet. Which interventions have proved that increase breastfeeding? We have interventions at different levels. In health systems and services, the Baby-Friendly Hospital Initiative, and the education of health staff. And the education of health staff, we are talking about education in service education and pre-service education. That means in the schools of health sciences. In the family and community, but it's important, and is the counseling and the promotion of support groups. In the workplace and employment, maternity protection in the formal and informal sectors. That it's a little bit difficult, but that's what it's recommended. And the marketing of commercial formula, that's what we're talking about today. That we talk about the regulation of the marketing across levels and different levels and different sectors. There is a conceptual framework on breastfeeding, and this conceptual framework indicates that we are able to reach the goals of appropriate feeding practices and, in consequence, maternal and child health, appropriate health, if we have existing determinants that at the level of mother-infant diet, in some settings, and multisectoral. The mother-infant diet, that we include the attributes of the mother and infant and the relationship between them. In settings, we have the health systems and services that include the health staff, the family and community, and the workplace and employment. And the structural are the ones that are basic and that include the political, economic, societal, and technological levels. And here we have the marketing of commercial milk formula and the political economy of commercial milk formula. What is recommended for having having all this implemented in an appropriate way is integrated interventions that include counseling support, lactation management, legislation, policies, financing, monitoring, and the political mobilization, social mobilization, and mass media. Talking about the multi-country study on the impact of marketing of breast milk substitutes and infant feeding decisions and practices, they included in this study country profiles, and important for us is that the country included country from all regions. And from our region, it was included Mexico, that according to the World Bank income status is in upper middle income. In terms of the implementation of the alignment with the code, it's moderately aligned. And in terms of the exclusive breastfeeding, has a 29% of exclusive breastfeeding rates. No, so different population groups have been included in this multi-country study, and we are going to be looking at here and some of the results. In terms of formula milk marketing exposure channels and tactics, they have found the formula milk marketing is sophisticated and multifaceted. So it is really expanding at all levels and very high level marketing. There is a multiplicity of online and offline efforts to communicate benefits and appeal of formula milk to women. So there's really a lot of effort. There has been a self-reported exposure to marketing. In China, 97%. And in Mexico, it's 39%. Women report being targeted by online advertisement and promotion. That's what they have been reporting. They have, in all countries, reported receiving free samples of formula milk. And they reported also receiving recommendations to formula feed their infants from a health professional. I'm going to show briefly a couple of tables that are showing that. Here we have the health professional recommendation to use formula. And in pregnant women, in Nigeria, that's the highest, we have 37%, and in Mexico, 20%. In postpartum, the highest is for Bangladesh, 57%, and the full sample, the highest is also Bangladesh. So we do have recommendations by health professionals to use formula. In terms of receiving a free sample of formula milk, you can see that either inside or outside hospital, the highest one is China, with almost half of the mothers receiving samples. But Mexico, for instance, it's 18% in total, but 16% of those, so the highest percentage is at hospital level. So mothers receive free samples at hospital level. In terms of engagement of women with formula milk marketing, women have fears and they have doubts about breastfeeding and the quality of their breast milk. And those fears and doubts are increased with the marketing of formula milk. So the industry uses those fears and doubts to propose solutions. Then there is advertisement and promotion of formula milk that affects attitudes of women. So women look at the advertisement and listen to the advertisement, then they revert sometimes to a decision to only breastfeed to start using formula milk. Then in Mexico, 53% of formula feeding mothers chose their current formula because of recommendation by a health professional. So you see the effect of the health professional in terms of the use of formula. And they have found also that many women prefer premium products. They look or read or listen to advertisement that says that children that consume this formula are going to be not having colics, they're going to be very happy, or they look at the advertisement and they say that the children are going to be very smart, and that makes them decide to use formula. So there is a pervasive industry influence that the problem is the baby behaviors. The solution that they offer is the commercial milk formula. With this, we have reduced opportunities to breastfeed, self-reported insufficient milk because less breastfeeding, more frequency of insufficient milk, and more commercial milk formula use than having breastfeeding cessation. So it's the exploitation of the industry of what is the human behavior. Why is the code so important? We do have proof that if the code is implemented as it is recommended, we have higher percentage of mothers, of infants with exclusive breastfeeding and with continued breastfeeding to the second year of life. And you can see here the difference with when the code is, the laws in the country are substantially aligned with the code. You have, for instance, more than 55%, about 55% of exclusive breastfed babies, and almost 60% of babies breastfed at 2 years of age. And it goes decreasing up to the moment that there are no legal measures implemented. What is important for having a good implementation of the code is not only to have the legislation, but also to monitor the implementation, because that allows us, it's key for maintaining gains and overcoming barriers. So as Michelle was presenting, the net code that is a network, was developed monitoring and continuous assessment tools of code implementation. Those are tools that they developed. And countries in the region have been using the monitoring tools, and they have reported on the findings. The methodology that's used include mothers interviews, health staff interviews, observation of health facilities, observation of vendor sites. So it's a comprehensive review. And the results and recommendations are included in the reports. And some countries have already made more than one monitorings, and they have been able to improve their practices considering their reports and the result and the recommendations of the previous report. What recommendations we have for protecting breastfeeding? They recognize the importance of breastfeeding, to acknowledge that breastfeeding is a human right, and we're going to be talking about that in short time. And the commercial milk formula marketing should not be permitted, because not allowing marketing doesn't mean that we are not allowing the availability of commercial milk formula. So if mothers, infants, or the health professional thinks that there is need of commercial milk formula, that will be available. But it shouldn't be marketed, because the marketing reaches all population. We know that breastfeeding is a collective responsibility, and the governments have obligation to invest in systems that enable breastfeeding at the different levels that we were mentioned before. And it's a need of multi-sectoral collaboration and programming to protect, promote, and support breastfeeding. I will finalize sharing with you the conclusions from the Lancet Series Paper 2 that indicates that the governments have obligations to ensure citizens can access impartial information about infant and child feeding and policies free from commercial influence. The structural and policy interventions are needed in all settings to enable, empower, and support women and families. And the breastfeeding success is a collective responsibility that depends on multifaceted policy and societal responses. We have a quote here that says, "The vital process of feeding infants and young children should be off limits to commercial marketing." Thank you very much.
Thank you, Carmen Casanovas, for your presentation, reminding us of the evidence of the code. And we saw presented to us, how mothers in particular are being affected by the marketing that is so rampant in some of our countries around the world. We're going to move now to our next presenter. We are going to have a presentation from Kathy Schatz, who is a legal specialist at UNICEF headquarters, and she's going to review with us the essential aspects of the code and some of the tools that are available. Welcome to you, Kathy.
Great. Thanks so much, Audrey. And can you confirm you can see my screen and hear me okay? Great. Thank you. Perfect. So Carmen's presentation was a wonderful segue into mine. So my name is Kathy Schatz. I'm a legal specialist within the nutrition team at UNICEF headquarters. I'm a global lead on everything to do with the code. And what I'd like to do today is talk a little bit about sort of the overall provisions in the code, but then really highlight some of the common gaps that exist in national laws, because especially in a region like Latin America and Caribbean, there are a lot of laws on the books, but they might be a little bit older and contain loopholes. So we'll take you through what some of those look like. So overall, when we think about the code, a lot of people just hear the word marketing, but in the code, marketing is just defined very broadly to include everything from sales, from healthcare systems to labeling. And so really we're talking about a number of different components that fall into three main categories of labeling and composition requirements, marketing in terms of promotion and sales, and healthcare systems. So this is just an overview trying to summarize all the code provisions before I go into some of them in more detail. But just to give you a sense, we're talking about prohibiting promotion, free samples, a lot of prohibitions on healthcare facilities and promotion of various kinds, on healthcare workers not receiving samples or financial support or incentives that create conflicts of interest, no donations of free or low-cost supplies, information that is allowed to be shared and that isn't, and labeling. And there's a lot of different rules about labeling, about no pictures of infants, about needing a health warning, about claims. And the quality, some composition requirements, and products that are unsuitable. So let's start walking through what are some of the common gaps that we see in existing laws. And one of the most common is labeling. This is the one that we probably see most rampant. Sometimes even when there are provisions in laws, we see they're not enforced. We see labels that contain all sorts of violations. One of the main types is health claims. So all the claims that you see that promise that they have either particular nutrients or omega-3 or vitamin A, or they promise to make your baby healthier or smarter, all of that is a violation of the code. And you can have a look at the bottom, an example from Bangladesh, which has done a really, really good job of coming up with a very clean label that really is the closest that we have to code compliance at the moment. And of course, now when we speak about digital environments, when we're talking about labels, we're not just talking about the physical labels on a can of formula, but we're talking about the depictions or photos of those labels that might exist in other places, including outdoor advertisements on the side of a bus, just as much as online. Next, promotion. Obviously, it is a huge gap. I'll come back to digital marketing. Another gap we get with promotion is often brand marketing. So a law should really prohibit not just marketing of the products, but of the brands. And then, of course, cross promotion. So that is the use of some products, whether they're follow-up formulas, growing up milks, or baby foods that use the same branding to promote infant formula, which might already be restricted by the law. That also needs to be covered and is often missed. And then when we get to healthcare systems, there's often widespread and significant gaps, especially in the provisions about engaging with health workers and the health systems, in the educational materials and the restrictions around those, and of course, the code in emergencies. It's often overlooked until there is an emergency, and then we see donations, countries being flooded by poor quality, sometimes contaminated formula, companies taking advantage of it. So it's very, very important for preparedness to make sure that's written into the laws. And then, of course, a common gap is around the scope of the code and the products that it applies to, which really needs to go up to 3 years of age. And that it has been clarified in a number of WHA resolutions, but it should cover all products that are breast milk substitutes up to 3 years, as well as any foods that aren't breast milk substitutes if they are marketed as appropriate for under 6 months, because we know that between 0 and 6 months, breast milk is or formula is the only appropriate way to feed your baby. So any food that is marketed becomes a breast milk substitute under the code. And then, of course, feeding bottles and teats. And then we'll get to one of the biggest gaps, which is digital environments. And what we know is that digital environments are now the predominant source, if not almost becoming the predominant source of exposure to promotion of breast milk substitutes globally. What this means is that any country that has a law that hasn't adequately dealt with digital environments is no longer up to date and is actually missing out on the predominant form of marketing and needs to be urgently updated. And as some of you may know, there was a guidance issued in 2023 on exactly how to do this. And this week at the World Health Assembly, hopefully there will be a resolution that will also be passed incorporating this guidance. And it's very, very important to have a look at this guidance, because what we did here is we really set out very practical ways that laws should be incorporating digital marketing. It's not enough just to mention the word online or say on websites, because digital marketing needs its own regulatory framework. It needs to identify all the entities in the digital marketing supply chain and place legal responsibilities on them. So it's not just the manufacturers, it might be the platform owners, the internet service providers. And it's very, very important that that is integrated into the law. And here you'll see I have a UNICEF product, which is a model law for protection of breastfeeding in South Asia. It's just the global model law that we most recently updated, and it includes digital marketing, and it includes practical examples of how you can apply this WHO guidance in this model law. It's not specific to South Asia, in anything that is relevant. So we are updating it for Latin America, but in the meantime, please look at this one for some practical examples. And then monitoring. So Carmen spoke quite a bit about the importance of monitoring. And the most important thing I'd say here is that it's so essential to incorporate the monitoring mechanisms into the law. It can't be something that is thought about after the law is passed. And this should include procedures for how you're going to monitor compliance and how that's going to be funded. And we know this is just from the same code status report that Michelle took us through earlier, that whilst countries typically do have responsibilities in their laws, they don't have procedures for monitoring. And that is missing, and that is very, very important to the success of laws. Even more important, I would say, is enforcement. And this is really lacking because for enforcement to be effective, it has to be targeted. And so it can't just be one financial penalty that applies to all of the entities that are going to be responsible for complying with the law. It should be targeted. There should be a range of sanctions that include non-financial sanctions as well, licensing, product recalls, alternative marketing campaigns, and they should be proportionate to the entity's size. So we're not treating a large manufacturer the same way as a small shop owner or a health professional. And once again, you need to have procedures for imposing the sanctions, and these are often missing from laws, which again, we did some analysis in the code status report where you can see that there are sanctions that are defined, but even when they're defined, those are typically not adequate. They're not doing any of the things that we really need to keep compliance, but certainly the procedures are still missing. And actually, we put a lot of guidance into this code status report about how you can do that. So you can have a read of that. And then another very, very key gap is conflicts of interest, which once again really must be addressed in the laws and must really specify mechanisms to protect government decision-making and the development and monitoring and enforcement from industry interference and conflicts of interest, including transparency, including due process requirements. And once again, we see this is incredibly low, including in this region when we look at laws. This is a huge gap, and one of the main reasons we know that laws aren't either even passed in the first place, but certainly aren't adequately implemented, enforced, and monitored. And finally, just some key resources on the code. You've already heard about some of them. All of these are available on our Global Breastfeeding Collective website. And I know that Michelle also shared some links, and we're in the process of translating some of these to Spanish. We have the guidance I mentioned on digital marketing. We've got the code status report that has a lot of additional information. And then we have a series of fact sheets about what I should know about the code, just is a short summary of exactly what's in the code and responsibilities. And we've got one about protecting from industry interference and conflict of interest. And the most recent one on the countering industry arguments, which is a list of quite a few of the common industry arguments and how to respond to them. And then finally, that model law I mentioned, which is just the most updated one we have from South Asia, which incorporates digital marketing. And then, of course, we can provide additional help. My email address is here on this slide for technical assistance to help conduct legal landscape analyses in your country or for anything else. So with that, thank you very much. And I pass it back to Audrey.
And thank you so very much, Kathy, for your presentation on the legal aspects of the code and some of the gaps which exist in national law and which need to be filled. Thank you. We're going to move now to Ignacio Ibarra, and he's the PAHO Regional Advisor on health-related law, and we'll hear from him his perspective on implementing the code and on code advocacy. Ignacio, welcome.
Thank you very much, Audrey. Yo voy a hablar en español. Creo que la mayor parte de las personas que están en el webinario
Thank
están.
you, Audrey. I will speak in Spanish. I think most of our participants are speaking in Spanish or understand Spanish mostly.
Para mí es sumamente importante tener la oportunidad de participar.
It's very important for me to be part of today's webinar, especially during the World Breastfeeding Protection Day. And the idea is basically, well, we just heard the great presentation from Catherine Schatz explaining the code's scope and how we should implement regulatory frameworks and follow what the code states. Now, I looked for the code's original image. As you can see on screen, it looks a little bit old, but well, it's written with a typewriter. There weren't any computers back in 1981, but it does not mean that its content is not perfectly applicable. I believe that the code was extremely visionary and it establishes the entire regulatory framework we've heard about.
El código, lo que necesitamos es
For
la
the code's implementation, what we need are laws and regulations, but not any law or any regulation. They need to be sufficiently clear, precise, and concise, that identifies authorities, that incorporates consequences, that details sanctions, and said sanctions should correspond to the person that is committing said sanction, and so on and so forth. Like I stated before, it's not the same for you to sanction a physician in their private practice versus the entire industry. There should be greater clarity in the regulatory framework. What do we see in Latin America? Well, there are several examples to it. Almost every country has a law associated to breastfeeding, but the international code refers to fundamental elements. My idea is basically to take everything we heard during the seminar and bring it into practice. The two elements, rules and prohibitions for breast milk substitute marketing, but at the same time, it's very important that we promote breastfeeding. And when we do the first, we do the second one, but when we do the second one, we don't necessarily do the first one. By this, I mean that most laws in Latin America are focused on breastfeeding, on protecting breastfeeding, but they don't necessarily include the entire set of rules required in order for them to refer marketing of breast milk substitutes. And that's where we found, or that's what we identify as gaps identified by PAHO. And I believe these are all gaps we must address. When we speak about children's rights, I mean, all rights should represent someone's collaborative representation. In other words, there should be someone with the mandate and with the commitment to protect said rights. We have seen that at the beginning, most of the children's codes focused on this obligation and they focused it on parents. But I can say that not all parents, not parents don't necessarily have all the elements to protect the life, the health, and if their children are exclusively breastfed or not. That's what the state is for. We yield a certain part of our autonomy, and for this we have the state. The intention is for the state to apply regulatory frameworks, for example, or maybe the industries, for example, they also have a mandate to follow, and that is to comply and respect human rights. And at the same time, they need to follow what the laws say. Now, there's a few examples, implementation examples. A few countries have created a law that simply details the International Code of Marketing of Breast Milk Substitute will be applicable to our country. And some transcribe it and others don't even transcribe it. But that is not enough. It's very important. I mean, the code was already approved by the the World Health Assembly, and of course, it has a mandatory aspect to it. But it is fundamental that we create a legal framework that details who, what, where are things done according to what the international code details. And of course, this requires legal frameworks, and it's most likely that the code will join other codes such as the Children's Code, health codes. We have specialized laws, as I was stating before, but most of them are mostly focused on, are exclusively focused on maternal breastfeeding, but they don't necessarily refer to the code. As a matter of fact, for us from the health area, we notice that this is an issue related to equity. When we talk about equity or equality, we're talking about all children being born with the same opportunities in life. We've already heard about the benefits and the standards and also breastfeeding. And obviously, breastfeeding is required to guarantee no perinatal deaths. We need to guarantee this in one way or another so as to reach breast milk or breastfeeding objectives. This means that mothers would have to go to periodic checkups during gestation with vitamins, appropriate nutrition, and so on and so forth. Why are we going to ask a mother to breastfeed her child if she's not well fed? The breast milk quality will be the same if we don't improve the mother's nutrition. For this reason, all these objectives are completely aligned. If there is no comprehensive regulation and monitoring, it's going to be very difficult for one single measure to meet all the specific objectives. And at the same time, it's very important for us to train families. They need to understand the importance of breastfeeding. I believe that there's very few hospitals or baby-friendly hospitals, and I do believe the entire health staff should share this information. There's a few elements, and I also believe that as legal frameworks are interconnected, they can meet the objectives of promoting and protecting maternal breastfeeding. When we care for the mother's health, and as I was saying before, social policy should include these components. A few countries have it, and at the same time, there are other rights associated. If it's less than an hour after delivery, well, there's no law in the Americas that states anything about it, but there should be a procedure, there should be a standard, there should be some clinical guidance, practice, standard, regulations, something that talks about this right in such a way that it's observable. And at the same time, review if it's done by the system or not. For example, eliminating obstetric violence, or for example, if it's the baby placed next to the mother's breast. This is not something, I mean, this is something that we're trying to see in Latin America. I'm not sure about the rest of the world. At the same time, it is children's right to receive or to be exclusively breastfed at least for 6 months or 2 months, 2 years, or even more. There are other elements associated, and at the same time, they need to become, that we need to promote it and we need to strengthen them. For mothers at work, 14 weeks should be the maternal leave, according to what the International Labor Organization states. But at the same time, paternity leaves. There are few countries, but there are actually more countries that are establishing paternity leaves in such a way that fathers may accompany their children during their first moments of life. Breastfeeding permits at their employment or with reduced schedules either at the beginning or the end of their work sessions. We are trying to promote the development of set legal frameworks so we can integrate them and at the same time meet the objective. There are other regulatory frameworks or other regulatory elements to consider. Altruistic donations of maternal breastfeed milk. What happens when a mother cannot breastfeed? Does she have to use formula? No. As state, we need to provide other alternatives, such as the creation of breast milk banks, for example. But there's few donations. It's an alternative, but there's few donations. For this reason, there's a part within the private sector that would like to use or cover this gap, this need, and there's a very interesting dilemma. Should we allow for private banks to operate or not in order for us to meet the maternal breastfeeding rate? And a few countries have been requesting for support, and there's a few guidelines to follow. As previously explained, each family is free and they establish their own regulations, of course. But just to give you a few examples, there's a few countries, well, we don't want for them to eliminate it because they do need to use commercial formula or commercial breast milk formula whenever the mother cannot breastfeed. But these are perfectly regulated conditions, or should be. There's a few countries that just disable availability on the shelf, rather have them being requested. As a matter of fact, a few countries have included a medical prescription in order for you to purchase commercial breast milk formula. In other words, there should be proof, a medical prescription that proves you are able to use commercial breast milk formula for your baby. And now, and obviously, just as I was explaining before, there's more access to advertisement through digital means. But at the same time, I believe this is one of this promotion is quite limited. The distribution within hospitals and with the medical staff, I believe we need to train human staff, human resources, and the staff and the health staff, and they should guarantee this does not happen. In the end, if they have to use commercial breast milk formula, they should be regulated just like any other product, follow specific regulations, highlight that there are critical nutrients added to it, such as sugar or salt or fats. And once again, we go back to the nutritional warning front labeling. It should be included in all breast milk formulas. There's a few countries that are currently including compliance. At the same time, we need to advocate in order for us to implement. There should be legal frameworks that are close to describing everything that is useful, and at the same time should be sufficient for authorities in order for them to meet the laws. But At the same time, we need to include other public health institutions, we need to include the academia, and mostly the civil society. At the same time, include advocates for compliance. The civil society is powerful when it feels encouraged in taking action. It's part of the civil society. It's part of what the civil society can do. At the same time, there's a few publications from the Parliamentary Global Group, and they focus on maternal breastfeeding between regulations that Parliament members should develop. Remember that Congress is not just about laws, they also surveil compliance of governmental actions and they authorize or grant financing for the entire governmental sector. So I do think that we have a few good lawyers, and from AHO, we wanted to implement these actions at all levels. Like I stated before, it's not enough to have promotion and protection frameworks. We need to meet them and comply accordingly. I thank you very much for your attention and for the opportunity to share my insights on how we implement said regulations. Over.
Thank you so very much for that presentation, reminding us that, and as Kathy's presentation also did, that the implementation of the code, the legislation of the code, is not just a health issue, but we have to work together with our legal partners so that, the cooperation is necessary so that we can move forward in helping countries in legislation of the code. For those of you who are asking about recordings, remember I said the webinar is already on YouTube and it will be on our website. And also our team has been doing a great job keeping up with the questions on the Q&A. So I'll remind you to keep putting your questions there, but we do hope to answer some questions live at the end of the webinar, which will be very soon, but not before we hear from Dr. Esther Toala from Panama. So we heard that before, that Panama is one of the only two countries in the region that has extensively legislated the international code. So we're going to hear now from her. She is a pediatrician and neonatologist and a member of the National Commission for the Promotion of Breastfeeding in Panama. Over to you.
Doctora.
Muchas gracias por la invitación y por la oportunidad de compartir con
Thank you
ustedes.
very much for the invitation and the opportunity to share information from my country, Panama. Panama is a small country with around 4 million inhabitants located in Central America.
Trabajamos en un hospital, en el Hospital Metropolitano
We
de
work
Obstetricia y
at
Ginecología
the Obstetrics and Gynecology
de
National
la
Hospital
Caja de Seguro Social.
from the Social Security.
Desde ahí,
And from there,
hemos venido
as time passes, we
dar un soporte a las
try
madres y a la
to
lactancia
support
materna
mothers
de
and
todas,
breast milk
de todas nuestras
and
pacientes.
breastfeeding
En realidad,
actions for all
soporte
patients.
inicial
In
de
reality,
lactancia materna en
the
nuestro
initial
país
support provided
fue dado por la comunidad médica
was
y
actually
por el equipo de
provided
salud.
by the medical community and by the health
Porque,
staff.
a pesar
For this
de los
reason,
avances
even though
tecnológicos y
there's
farmacológicos
pharmacological and
para la
technological
supervivencia de los
progress
adolescentes
to
prematuros,
increase our
tuvimos
premature
la
patients,
necesidad de buscar
we had
formas de
to
alimentarlos que se
seek for
condicionaran
ways to
dentro de
feed
cada
them.
uno de nuestros
And of course, this was a
países.
grand challenge for each of our
Nosotros en
physicians.
1980
Since
creamos el
1980,
Tratado
we
Institucional
created the
que
Institutional
en
Act,
realidad es el sitio
and
donde
in
cada
reality, it's the
madre va a obtener
location
la leche de
that
su
every
pecho
mother
descompulsado.
attends to to receive the milk for their hospitalized children. And that's basically the beginning of oral steps. And the intention is to align ourselves with the code in defense of our children's health. In 1980, the National Commission for the Promotion of Breast Milk was created, Consolarma. Consolarma is constituted by different areas, different institutions, ministries as well. Basically, it's led by the Ministry of Health, the Social Security, the Ministry of Work, of Labor, the Ministry of Education, and the Ministry of Commerce. At the same time, we have members from medical societies such as pediatrics, obstetrics, the National Association of Nurses, members of the civil society, and unions. These are all the commissionaries that are part of the National Commission for the Promotion of Breastfeeding in Panama. In November 1995, Law 50 was promoted, a law that protects and promotes breastfeeding, the first law in our country. During this time, it has had several modification attempts, and I say attempts because the National Commission for the Promotion of Breastfeeding has always been attentive to the different modifications to the law. And for this reason, in the year 2020, the law was reviewed by the Assembly to conduct a few modifications. And the modifications created great gaps. As a matter of fact, Law 50 protected the population more than the new law promoted, Law 135. And for this reason, we, well, we conducted painful actions because remember, on the business part, they always include all the elements that they're going to refer in their key points. Those are the points that they're trying to advance with. However, since the law was not sanctioned, we decided to work and see how we could regulate the different changes throughout time.
La reglamentación de la ley 50. 17 años después que la ley saliera en 1995. Esta reglamentación
This is a regulation that also has support from the National Commission for Breastfeeding, but at the same time supported a regulation that adds a few items regarding what the law includes. And at the same time, there was no way to carry out the changes required. For this reason, in the year 2020, a new law was created, Law 135, and even though they tried, it was not created since it did not meet our expectations. As a matter of fact, we felt it created more gaps, that honestly, existing gaps were worsened by this new modification requested. For this reason, all the changes in regulations
han sido unas
have
luchas
been permanent struggles. And as a matter of fact, just yesterday, with the new law that we're trying to align with our code, a new law that we're trying to develop so it protects the population, the mothers and children, a law that protects breastfeeding in our country in general. Yesterday, it went through its second debate, and our colleagues we're at the National Assembly trying to promote and take action, avoid being elastic and flexible with the different companies, because we need to remember that those that work for the population for with the laws are those that intend to protect their population, their mothers and their children. For this reason, the National Commission for the Promotion of Breastfeeding has been the strength of our entire health system, and it has served to protect breastfeeding in general. At the same time, through the commission and through one of the sections in the law, it details that mothers should have 1 hour for breastfeeding. Oh, this 1 hour included several weaknesses because, well, there's a few mothers that did not breastfeed. However, they wanted to use the breastfeeding hour, not necessarily to breastfeed their children, but for other activities. And of course, we try to see how we could implement breastfeeding rooms at the working locations or at the work location. And little by little, we have accomplished it. In other words, we have more than 100 breastfeeding rooms in companies today. However, Plasma considered it was important for all breastfeeding rooms to be certified by the Ministry of Health because, of course, there are a few companies that were actually donating the breastfeeding rooms. But of course, the rooms were accompanied by logos and propaganda and advertisement that truly violated the code. For this reason, it was not possible for us to, it wasn't possible for them to accept the donations for the breastfeeding rooms. At the same time, implementing breastfeeding rooms in all institutions, private companies, they all have to implement a breastfeeding room and they are granting some time for its implementation. I believe the health team's intervention has been very important because we're very used to working, monitoring, and supervising. And I do believe it's the element that has helped us advance and align with the efforts. Now, within institutional actions that we believe help in order for more countries to reinforce their laws, the code's dissemination. We are sharing information related to the code, and we're trying to make it as a mandatory action for all health staff, doctors, physicians, for gynecology staff, for obstetrics, pediatric staff, neonatology staff. All these areas need to share this information. The entire staff should have and should go through the 2 hour YAM course focused on breastfeeding. And in 2018, when the course was established, we included the code's implementation. We do believe that the code is necessary, but we cannot implement it if they're not related to it. For this reason, we're printing out the code, making it available to all. It's a very short document, and we're sharing it with the human resources leaders in such a way that they are familiarized with the code and defend it and stand for it as well. At the same time, we need to continue monitoring compliance. In Panama, two monitoring assessments were conducted in 2010 and in 2019, October 2019. Throughout the monitoring efforts, violations to the code were identified. But it's been difficult for us to truly apply sanctions to said violations to the code. We still don't have clarity on which is the way to apply the sanctions to said violations to the code. We are trying to see if whether we report the violations to the Ministry of Health or what should we do. And so far, we haven't had any sanctions whatsoever. No company has been sanctioned yet. And this is a pending task. At the same time, improve services, keep them free from conflict of interest, and at the same time, avoid donations. At the same time, if there are medical locations that sell breast milk formula, I believe that the medical part has truly helped us. And at the same time, this has allowed for visitors not to even walk around the hospital's hallways. They just cannot be there. They just cannot access our institutions whatsoever, much less speak with the mothers. Our contact with them is precisely through physicians. If at some point they decide and they receive some sort of scientific information and they would like to share it, remember that in our country, breastfeeding is not mandatory. For this reason, we do explain the mothers the benefits of exclusive breastfeeding. We try to support bed by bed with staff members supporting, and at the same time, we want to answer mothers. And at the same time, even though there is information supply, and at the same time, it's mandatory. And at the same time, we need to inform the mothers how they should feed their children with formula. And at the same time, mothers with absolute counterindications, and at the same time, if they're mothers with HIV, of course, there's a counterindication to breast milk and breastfeeding, or mothers with viral diseases, or mothers with who are lactose intolerant. Of course, those are counterindications, and you do need to provide support to the mothers. And at the same time, we need to explain to them how to prepare the breast milk formula. And at the same time, work with institutional policies. At the same time, I believe that the most important points we need to align with the code, and at the same time, it has to do with the promotion and protection of maternal breastfeeding, all fundamental for us to meet such seek for to reach the rates we're seeking for. Right now, our breastfeeding exclusive breastfeeding rate is quite low. Honestly, there has been a tremendous struggle with the marketing of breast milk substitutes and breast milk formula companies. In our country, all the information that is related to breast milk formula, they're bombarding constantly with their product. For this reason, we need to dedicate internal efforts. But honestly, the population is usually informed through social media, or they receive information through foreign channels. And at the same time, they do hold much information. And at the same time, it's about customized advisory or customized advisory or consultants on breast milk and breastfeeding. Right now, it's currently developed by the Ministry of Health, and at the same time, they're working on the mandatory implementation of courses focused on breastfeeding, which is an initiative from the Baby Hospital Initiative, the Baby Friendly Hospitals Initiative. As time has passes, we have lost it a little bit, but we still want to continue with the Baby Friendly Hospitals Initiative. And right now, the only hospital included is the one related to the Social Security. Aside from this, institutional support from breastfeeding advocates, since they truly help the mothers and they truly help breastfeeding's future. In order for you to have sufficient breast milk, you need to have an adequate breastfeeding culture. All mothers need to understand which are the benefits related to maternal breastfeeding, and there should be specialized staff. And the specialized staff should support exclusively and provide advisory in
madre
all areas,
durante el prenatal
and at the same time provide advisory
posteriores
to mothers during the prenatal care and postnatal
de crecimiento y
care
desarrollo.
consults, and also during the growth and development consults with the pediatricians.
Se avanza en la cultura del amamantamiento, tenemos excedentes de leche.
At the same time,
Donantes
we have mothers that are donors of excess breast milk, and they, in this way, can contribute to the survival of premature children since they don't have access to their mother's breast milk. We do have a pasteurized human breast milk bank. It's been working for 11 years. It has never stopped, continuously providing support. There's been a few venue changes, especially during the pandemic. The neonatology service was eventually transferred to another hospital about 15 kilometers from the city. And at the same time, they eventually returned to their headquarters at the Arnulfo Arias Madrid Hospital Center. And once again, in November last year, we went back to our final venue, which should be the Metropolitan Hospital for Obstetrics and Neonatality for high complexity neonatal and obstetric care. Honestly, we are preparing to commemorate the World Breastfeeding Protection Day. On the 19th of May is the breast milk donation day. We also conduct diverse activities to promote breast milk and breastfeeding. And of course, on the 21st of May, which is today, the World Breastfeeding Protection Day. I thank you very much for reinforcing, for strengthening, and for supporting the breastfeeding culture and for promoting the International Code of Marketing of Breast Milk Substitutes. Thank you.
Thank you so much. You know, it's always good to hear from the countries what is happening in their implementation of the code. So I want to thank you again for bringing Panama's story and including the challenges, because we have to look at realities, and that is the way that we will be able to improve and to overcome them. But at the same time, there is progress, so we want to congratulate you on the progress which has been made. All right, so we have run somewhat over time, but the questions, you have been putting your questions in the Q&A as we requested, and they have for the most part been answered. There is one question that I will ask Michelle Alvarez to answer, one of our earlier presenters. If you could tell us, if you can answer this question, can you tell in which article or resolution of the code I can find coverage up to 3 years of age? So that was one of the questions asked. Could you address that, Michelle?
Gracias, Audrey. Muchísimas gracias por todas las preguntas que han
Yes,
puesto.
thank you, Audrey, and thank you very much for all your questions. Many of them were answered by Quesali Ramos, and many of them were answered by UNICEF. And actually, out of the answers, we have shared a few resources, and there you can specifically find information related to the code's different articles and the different discussions related to the code. And at the same time, consider the code's specific scope range, which is up to 36 months of age. In the chat box, we're going to share Alsana's link, and you should be able to find many of the resources presented today on Alsana's site, as well as the code status report at a global level. And at the same time, there's a very useful document on what we should know related to the code. I think that answers the question from our colleague, right? Or I think this answers our question, right, Audrey? Does this
Yes,
answer the question?
yes, I think it does. Thank you so much. All right. And I do realize that we are somewhat over time, and not to keep you any later, we have to wrap up, but I want to thank everyone for participating. I want to thank, first of all, the presenters. And as you could see, everyone can see that they're all passionate about this topic, about protecting breastfeeding and about, helping countries in adopting, legislating, and monitoring the International Code of Marketing of Breast Milk Substitutes. So today we looked at highlights of the regional situation on breastfeeding and on national implementation and monitoring of the code. We had a review on why we need to be concerned about the marketing of breast milk substitutes. We heard about the essential elements of the code and, importantly, what countries need to do to implement and monitor the code, and how we all need to, with our partners, engage in advocacy on the code. And we had a very real life example from Panama. It was a pleasure being here with you today. I have to remind you, you will be able to find the recording of the webinar on our website. But as we wrap up, I wish you all a productive rest of the day on World Breastfeeding Protection Day 2025. Bye.